The ischial tuberosity is one of the main attachment sites for our hamstring muscle groups, as well as it's known as our sit bone. Not only is it on the inferior aspect of the hemipelvis, but we can palpate it on the inferior aspect of our gluteal fold. The greater sciatic notch and lesser sciatic notch are completed to become the greater and lesser sciatic foramen by the sacrotuberous and sacrospinous ligaments respectively. The sacrotuberous ligament attaches to the sacrum and the ischial tuberosity, whereas the sacrospinous attaches to the sacrum and the ischial spine. And although those two foramen are completed by ligaments, the obturator foramen previously discussed is completed by bone, specifically the superior pubic ramus, inferior pubic ramus, and ischial ramus. Ramus refers to an arm or a branch-like projection, and here we can see the pubic body and the ischial body, but we also see these projections off of them. The inferior pubic ramus joins the ischial ramus, forming the ischiopubic junction, whereas the superior pubic ramus stands alone. Right around the point in which the superior pubic ramus originates, we have the pubic tubercle, and the pubic tubercle serves as an important attachment site for the inguinal ligament, with the other being the ASIS. Therefore, the inguinal ligament sits like this. The ASIS is known as our anterior superior iliac spine, and just as we have an anterior superior one, we have an anterior inferior one as well. This is known as our AIIS, or anterior inferior iliac spine, and just as we have two spines on the anterior aspect, we have two on the posterior aspect of the ilium as well, known as the posterior superior iliac spine and posterior inferior iliac spine, or PSIS and PIIS respectively. In between the superior iliac spines, we have the iliac crest, and whenever we put our hands on our hips, this is the bony landmark that we are contacting. Inferior to the iliac crest, we have an iliac fossa. A fossa refers to a shallow, depressed, defined area, and that's exactly what this is. Shallow, depressed, and defined. And within this iliac fossa, the iliacus muscle sits, outlined by this red area. Analogous to where the iliac fossa lies, but on the posterior aspect of the ilium, we have the posterior, anterior, and inferior gluteal lines. These gluteal lines serve as important attachment sites for the gluteal muscles, with gluteus maximus attaching posterior to the posterior gluteal line, gluteus medius attaching in between the posterior and anterior gluteal lines, and gluteus minimus attaching in between the anterior and inferior gluteal lines. Furthermore, on the medial aspect of the ilium, we have the arcuate line of the ilium. Arcuate refers to bow or curved-like surface, and that's exactly what this is. The arcuate line of the ilium is continuous with the pectineal line of the pubic bone, or the pecten pubis. Together they form the iliopectineal lines, and together the left and right iliopectineal lines contribute to forming the pelvic inlet or pelvic brim.